heart can be donated like Dr. Rajiv has explained. One is patient is brain dead. That means brain is totally gone, but the heart will be functioning. So that most of the cases after assessment in a healthy person, young person, associated heart is sometimes heart will don't have. The hole is there, we will close, correct it, and the heart can be used in a younger patients. That is one thing. Other thing is, as he mentioned in Australia, in Sydney only, first time it was done in 2015. That is, if somebody is brain dead, but the heart is still beating. Heart will beat, oxygen is going into the lungs, still he is breathing spontaneously. In the end, the heart will just stop. So those type of heart, that machine is there where it supplies oxygenated blood into the heart. So adile keep giving blood and see how the heart is performing. Some heart may not be usable in these type of hearts where the heart stops by itself and resuscitates the heart. But few of them are usable. So aduvanda we can get more donors. Because the India on the brain dead only we are using that. If they can get this also passed medically, then we will get more donors. But we need machines to transport, and the machine is there, you can transport for longer distances and maybe few hours the heart will withstand because blood supply is going into the heart. Whereas at the moment what we are doing is stopping the heart and then transporting it to the nearest place by air and then green corridor. Up to 3-4 hours the heart will stop. Other machines probably we will be getting it soon. I think is it available here?
No, sir, it's not available.
Not available. So that abroad they put this on the machine and supply blood to the heart. Heart will keep on beating because it is like normal. Oxygenated blood is going into the coronary artery supplying the heart and the muscle. So it will withstand hours of transportation without any problem because the distances, especially I was talking to them in the US, so from California to New York they can transport the heart. Because the whole country, they have only one system. Wherever who is listed in priority, whichever may be the state, the heart will be transported. So effective is the system there. Because people are, so many patients are, whatever artificial resuscitative measures like artificial implantation of artificial heart, inside, all those things, artificial pumps inside the heart. Adhikella side effect is there because anticoagulants, battery to be connected from outside. The best treatment of heart failure today is heart transplantation. Because all other things have its own problems. If you are artificial heart, left ventricular assist devices, that is expensive. It may cost like 50-75 lakhs. The battery has to be connected outside to work. The patient has to carry the infection, blood thinning tablets. So it's sort of there are people living like that, but it's not, especially in our situation, it is not as good as the results in other countries because they are very well organized. The transplant is a separate department just to look after the patients, separate cardiologists are there visiting different hospitals, patients are stationed, follow-up. We don't have at present that sort of facilities in our country. So we are doing with the limited facilities what we can do. What is ideal is not practicable. If you wait for an ideal situation, we will never do anything in this country. So we have to modify things and make sure we do things almost the same level in the world. So finance, insurance, all these are big problems.
After transplantation, can the patient lead a normal life?
Absolutely. Important, that is the important thing. See if a patient is taking enough medicines, tests are done properly, they can, because these medicines also are expensive. What happens is unless they can afford to take this medicine, doing a transplant sometimes may not be a good thing also. They cannot afford suddenly, their longevity is less. That is why the people living after transplant, taken care of, they can lead a normal life, 20 years, 15 years. A lot of people living, doing all normal, even mountaineering, playing tennis, all those people are doing.
Sir, any age limit is there?
Age limit as such, it's 65, 65 or?
Up to, see, that depends. Like most probably we prefer taking donors up to 40 years, but beyond 40 years, then we have to assess them further. Up to 50 and 55, we do take.
You are talking about recipient or donor?
Donors. That's what they are.
I don't know.
Oh, recipient.
Yeah, must be.
Recipient.
You are asking about recipient or donor?
Donor, what I said is right. I'm like, we usually assess patients up to 40 years, and beyond 40 years, then we have to evaluate them further, like because some patients might be having coronary artery, coronary artery disease, so we have to evaluate them. Then further, after a good, if the heart is found to be good, then we can go ahead with the transplantation.
If the donor age is nearly 20-25 years,
yeah, we can go ahead.
We can donate. That suits for above 60 years patients.
Above 60 years, no. We usually don't go ahead with older donors because they might have associated cardiac disease. So we usually prefer young donors, preferably less than 40 years.
Dr. Rajiv?
Yes.
So what is the rejection rate of the transplant in India and whole world?
So the rejection rate is up to 5 to 8%, if I'm right, for the DBD donors, for the brain dead donors, and it's almost the same in India. The main cause for rejection is the adherence to the medications that the patients are taking. So if they're adherent, they're compliant, then they can survive for a longer period of time without rejection. So if you're talking about immediate rejection, it's just about 5 to 8%.
Sir, how long period does the patient need to maintain result?
I didn't get your question, sorry.
Patient, how long period he needs the medication?
Medications. So it's lifelong. He is on an immunosuppressant which reduces the immunity so that the chance for rejection of the donor heart is less. We are reducing his immunity so that he doesn't develop antibodies against the donor heart. So it's a lifelong treatment. Yeah.
Sir, the organ எவ்வளவு நேரம் travel ஆச்சு சார்? எவ்வளவு நேரத்துல 4 hours ஆபரேட் பண்ணீங்க? கொண்டு வந்தது எவ்வளவு நேரம்? எப்படி கொண்டு வந்தீங்க?
It's within 20 minutes. By road.
எங்க இருந்து?
So any special permissions ஏதாவது வாங்கியிருந்தீங்களா கொண்டு வரதுக்கு?
No, we didn't ask for any permission. It was done in the early morning, so we had we had no issues.
Traffic.
No. It was early in the morning, so we didn't have any
From
issues.
where you harvested this organ?
We're not supposed to.
Within Chennai.
Within Chennai, we are for confidentiality of the donor, we are not supposed to medically tell you where and whose body heart has been. It has been in the city of Chennai only. So we did ask for a green channel because the police were willing to give us because it is, I must tell you that Tamil Nadu is the most organized sector in organ transplant. So here we should be all proud of that because cardiomyopathy, you see, cardiomyopathy could be primarily muscle weakness. So many varieties are there. Heart muscle ரொம்ப hypertrophy hypertrophic cardiomyopathy வேற ஒரு விஷயம். That is all genetically acquired only. அப்புறம் வந்து severe valve heart disease வந்துட்டு operation பண்ற patient, they go into heart failure. No way we can treat with the medicine. Heart attack வந்துட்டு bypass பண்ண patient heart failure வரலாம். Young patients like 50-year-old, multiple blocks, stenting, 2-3 heart operations, patient persistent heart failure, we do transplant. Then children with complicated heart problem by birth, they also undergo operations initially because this is the last resort. Heart transplantation, everybody thinking if you put a new heart, everything is fine. It's not like that.